some other methods for trying to release the hip flexors and just legs in general are to use a foam roller. A lot of people have used foam rollers. So initially I'm lying down. I have it once again about belt line. I can roll forward, even pressure on both legs. That's usually not too painful, not too many trigger points that way. But I want to roll all the way down to my knees, to the kneecaps, and then roll back. Now let's say if on my right leg I want to put a little more pressure, what I'll do is double up, put one leg on top of the other. Now I'm going to feel a little more pressure there. When I find a knot, I want to try to stay on that spot for 20-30 seconds or so, roll back and forth a little bit, or even just try to relax on that spot. After I've done my whole quad, now I'll start up in the hip, and this is really good for back pain. I'm on what's called tensor fasciae lata. It's a small muscle in the hip. Now as I roll, I'm on my IT band, which can be pretty uncomfortable. If it's too uncomfortable, then you want to take one leg off, roll forward all the way down to the knee again, and then slowly coming back. If there's ever a point where it's too painful, roll away from it, try to take a little bit of pressure off, roll back from it, just to reduce the pressure. Because the idea is to essentially massage your legs and hips doing this. It might take you anywhere from 10 to 20 minutes to do all of it. To hit some of the front of the hip, sometimes in the psoas area through here, there's my the front of my hip bone. What I'm going to do, use a softball. Now you can do this actually using a medicine ball, something a little bit bigger, but this can frequently hit the trigger point pretty well. So I'm rolling on that ball, and I've got some pressure on my elbows, some on my opposite hip. So I might just stay like this for 2 or 3 minutes, trying to hit some of the trigger points there. Now, because the ball is rounded, you can actually roll it inside that bone on the hip, so I can let it dig in right there. It's not going to feel that comfortable. It's like a massage therapist working on your psoas, but it can help release everything, and it's pretty effective results. Okay, you can also use smaller balls for that, baseball or lacrosse ball. All right, one other technique. Camera person, come in here. So with this method, what we're talking about is how to release the hamstring. A baseball works fine if you're doing this on something hard like a kitchen table. I'm doing it on a massage table, so I'm using a softball a little bit bigger. I put it underneath. Generally you can start all the way up right behind the knee, and I want to straighten into it so I can feel the stretch. I can also feel the ball digging into some trigger points in the back of my leg. So when I'm like that, I can twist my leg out, I can rotate it in, and I move the ball up an inch or so. Go through the same procedure. Essentially, you're trying to let the weight of the leg relax into the ball. And then move it a little further up. I feel more of the high trigger points there, but you can take it all the way up to the basically the pelvis. So about 5 to 10 minutes on each hamstring. So.